We had this bill came before the Health Committee a couple of weeks ago, and I was there, voted for it, but we had a series of questions which you were unable to answer then. It's been a couple of weeks, and I'm hoping that you're going to be able to answer those questions now. In the event that this money is reinstated, do you have a budget and a breakdown of where this money is going?
So right now we are finalizing the plans with the Family Planning League, which is the grantor of this money, to determine where health center locations need to be, where we need to expand services and other innovations to expand access. So we are finalizing those plans now.
So the answer is you don't have an answer right now, today. So you want us, is that the answer?
Well, we're finalizing the plan.
But finalizing, that means that you don't have a plan.
We are finalizing
but you can't, so you can't give it to us today. As members of the Budget Committee, you're unable to provide us with that information.
Well, I just said that we are assessing health center locations. We're going to expand services, and we're just determining, we are finalizing the plans on where we're going to do that.
We're getting stuck up in words because you're finalizing, but the answer is no, you don't actually know where it's going in order to tell the committee today.
We have plans for where those are going. I don't have them to share with this committee
that's
today.
The answer. You can't share with the Budget Committee where those monies are going as of today.
Well, I can tell you that we are expanding services and we are looking at health center locations. Yes, I don't have a plan.
And those health center locations include the FQHCs and the hospital-based clinics. Is that correct?
So Planned Parenthood is not an FQHC. The funding goes not just to Planned Parenthood, it goes to other family planning health centers.
Excellent. Do you know what the annual revenue of Planned Parenthood in the United States is per year?
I don't know what the United States revenue is.
Okay. Do you know what it is in the state of New Jersey?
I don't have it off the top of my head.
And the post the Affordable Care Act, you talked about the cost for birth control, but under the Affordable Care Act, birth control is free for women. And so what have you seen as a change now that the Affordable Care Act has been enacted versus before? Because if it's free regardless of income.
Well, it is free regardless of income, but only 18% roughly of patients at Planned Parenthood in New Jersey are covered under the Affordable Care Act private insurance. So it's not free unless you are covered under insurance. 40% are paying out of pocket.
Right, but under the Affordable Care Act, you're supposed to have insurance because we still have the Affordable Care Act still in place, correct?
But 40% of our patients do not have insurance.
Okay. Can you tell me what the average executive compensation is for Planned Parenthood in the state of New Jersey?
Not off the top of my head, no.
Right. Well, we asked these questions of you 2 weeks ago, so I expected that perhaps that you would know that we would be asking these questions again.
Well, I'm happy to share information about health services, but I'm not going to share information about employee salaries or other personnel issues.
Okay, very good. Well, the one thing I do want to say is that if we want to increase the health and access to health care across the state of New Jersey, one of the first things we should do is that we should allow all health care practitioners to practice to the full extent of their education and training. And we should release all barriers to practice. And this means allowing advanced practice nurses. And I'm just using this. This is not a question, ma'am. This is a statement that I'm making to you. And I know that you use them. I'm just making this as a statement. Okay. And I think that we can move a 854 through that would actually increase access to health care. But I think that we need as a budget committee to understand where the money is going and who is getting that money. And I think it's incumbent upon the providers, the health clinics, your organization, and the FQHC to provide that information to us. The number has remained the same from 8 years ago, 7.45 million, to now. That hasn't changed. We need to know where that money is going.